along with the along with our slide set online so that other people can view it. We have a fairly small group tonight, so please feel free to ask questions in chat. We'll do our best to try to answer them. If we don't get to all of them, we will respond after the meeting. Next slide, please, Donna. We have a fairly full agenda for you tonight. We're going to have a welcome from our Assistant Health Director for Population Health. And once we finish with that, we'll move into an introduction of the community health assessment process and how it works and its purpose. And then we're going to do a walk through some of the data that we have looked at for the 2022 community health assessment. Donna is going to give you a flying overview of health data in Mecklenburg County, and then discuss our community opinion survey and some of the findings from that. And then we'll move into a group activity where we can ask you all your opinion on the priorities for the county, and then finish up with next steps and closing remarks. So let's move on to Dr. Kimberly Scott, who is our Assistant Health Director for Population Health.
Thank you so much. Good evening, everyone. We are so excited to have you join us today for this important conversation about our community health assessment. So thank you for joining us this evening. The community health assessment is conducted every 3 to 4 years, and it's really an important opportunity to collect, analyze, and review data to just really understand what's happening as far as a snapshot of health in Mecklenburg County and drivers of health. So whether you're a resident who's just really looking to understand what's happening in your community, or you're a community-based organization that's seeking information to help you guide your decision making, we really hope that the information provided today is valuable to you. And also, we hope that you leave today knowing that our team is committed to advancing health equity, and access to data is an important step in this mission towards health equity. So thank you to our incredible team led by our epidemiology team and our core health system partners and nonprofit partners who make this process possible. We're excited to have an intimate group tonight to really engage with you, and we really look forward to working alongside you in this work to enhance health and quality of life in our community. So again, thank you for joining. We look forward to engaging with you throughout tonight's meeting.
Thank you, Dr. Scott. Next slide, please. I don't know if there's anybody on tonight who's been through this process with us before, but if you have, you will notice that we have a big change in the way that we are doing things that we're excited about. Public Health has teamed up with Atrium Health, Novant Health, and One Charlotte Health Alliance to partner on the community health assessment. Instead of each organization doing their own assessment, which duplicated efforts and ran the risk of sometimes confusing people with all these different assessments, it seemed to make more sense to pool our efforts and have one single assessment of the community. So we are very pleased to be working with our new partners and excited about that opportunity. The only hitch in this arrangement is that we're all on different schedules for our assessments, and the hospitals are required to report in every 3 years, whereas Public Health was working on a 4-year schedule. So we have agreed to move to doing this assessment every 3 years. So the next assessment will be in 2025. We also have people that within the 3-year period still have different due dates within that 3-year period. So we have Novant up first, who needs to get their assessment done by the end of the year. And in order to do that, they have to take the findings from this assessment and take it on to their individual hospitals to come up with their priorities, a process that's going to take them some time. So that's why we're sort of having this presentation now, even though the county assessment is not due to the state until the beginning of next spring. So we are going to continue to work on refining our data and building a more interactive data process online to get full information on the report out in the meantime, because we have the luxury of that time before ours is due. But you can see some of the challenges that we've had, but we've been happy to find workarounds and to come up with a way to make this happen. And we're pleased and excited to have this opportunity to work together, because we feel like it will give us a better ability to define the problems and actually try to meet some of the needs in our community. Next slide, please. Community health assessment, as Dr. Scott mentioned, is something that we do to give a closer overlook of the health in our community and the health indicators. We start out by reviewing data. And when we say that, we mean we look at all of the quantitative data that we can get our hands on health indicators in the community. This may be data that comes from birth certificates, death certificates, communicable disease reporting that we do, any kind of reporting that comes out of the health department. We also look at census data and data that may have been reported by other agencies, universities, groups that work in our area where we feel like we have solid data. We have both quantitative and qualitative data. Much of what I was just talking about is quantitative. We also want to hear what people are thinking. And so we do a community opinion survey and meet with different groups in the community to talk about their opinions on health in the community. This time in the community opinion survey, we provided some open-ended questions and have been quite pleasantly surprised at the response that we've been getting. People seem to have a lot to say. So at a later time, when we have the opportunity to write all that information up, you will get a taste of how people are feeling about some of the health issues here in Charlotte, Mecklenburg. Once we've collected all of this data, we put it together to try to look at the health focus areas in the community that we feel like are most important as indicated by the data, and then take the data with the community opinion and prioritize the findings to the things that people feel like are the most important to concentrate on at this time. Once we come up with our priorities, we're going to communicate those findings by sending out reporting, newsletters, media reports, however we can get information out to people. Because the point of this data is not to have a report that sits on a shelf. It's to let people know what we've found out and let them then use that data to do the important work of trying to make a change in the community. And that's where our action planning comes in. That is the last part of the process, when we take the data and turn it into plans and priorities, plans and objectives for addressing these health priorities. And the action planning is another step along the way where we'll get community involvement. So now that you've signed up for this meeting to learn more about health in the county, we've got your email addresses. So we will be sure to contact you in the future to see if you have an interest in participating in this process. Next slide, please.
Sorry, some of the slides are sticking.
I think I've just spoken to the community input part being an important part of our process. So I think we can probably move on to prioritizing. In some years in the past, we have actually sat down and used this data to develop priorities. In the period of time since we last did that, we've had a few factors intervene. One of them is the recognition that significant change is kind of hard to achieve in 3 years. You say we've got a priority, and by the time you come up with a plan for addressing it and start to implement it, 3 years is over. So it's a little bit disconcerting to say, okay, now we're going to have new priorities. So we're looking at trying to use the data and public opinion to reaffirm that our priorities are still what they were before, The other thing that sort of disrupted this process is the pandemic, and COVID has put a lot of us on a slower schedule. And any kind of initiatives that we were attempting to implement and services we're delivering, we've worked steadily through the pandemic, but it's still challenging in some cases to make the plans move quite as smoothly as we would have hoped to. So another reason why we don't want to suddenly change horses in midstream and move on to something else. So rather than selecting new priorities, we're going to, again, we've reviewed the data, we've come up with the areas that we think that are important and that the data supports as being important. And then we're getting community input to see what other people feel like are the issues that are most affecting them or their clients in the community. And we will see how those match up with the priorities that we currently have. Then with the 2025 community health assessment, we will actually look at a process for going through and either affirming the old priorities or selecting new ones. But by that time, we should have a chance to be able to look at our community action plans, see if they're making progress, see what the data looks like, and check to see where we are at that point. Okay, next slide, please. The current priorities that we are looking at, that of the priority areas that we have, the ones that were selected for the top 4 are mental health, access to care, chronic disease, and violence prevention. And we have planning underway in many of these areas, some of it more developed than others. Some of the plans actually implemented more than others. So again, we'll check in another couple of years and see how those are doing. And we'll look at your opinion and opinion from other community members, as well as our data, to make sure that there's not something else that we're missing. You know, if there's something that we don't have on our list that you think needs to rise to the occasion, we want to know about it. If there's something that's become much more urgent since these priorities were developed, we'd like to hear about that too. So now we're going to move into a flying overview of health data in Mecklenburg County, which Donna is going to lead you through. So I will turn it over to her.
Okay. Just want to say good evening again to those who have joined us for tonight. And I'll be doing a couple of things, including looking at the data and providing you with oversight or overview of the data, but also checking to make sure that as people are joining, they're able to get into the meeting. So I might be looking back and forth between 2 screens. And if so, that's why I'm doing that. Before we get into the data, I just wanted to stop again and thank the staff who worked so hard on getting this data together. So for our program area, that would be Sharice Jenkins, Brittany Reynolds, Alexia Williams, and Ramona Khan. They've worked extremely hard to get all of this information together, and also our community partners who share data with us as well. We are going to be looking at preliminary findings, and what we mean by that is that, as Susan mentioned, this is an ongoing process of us looking at the data and updating information for the community. So as we build out that interactive dashboard, we'll be updating the data with more current information, but these are data that are current up to this point in time that we're going to be sharing with you. And this is information for Mecklenburg County residents. The other thing to remember about that is that even though we're going to show Mecklenburg County residents, we also may show comparative data by looking at national data or state level data as well. So let's go ahead and start the data conversation off by looking at our overall demographics here in the county. We're not going to talk about every single metric of demographics, but we are going to talk about some of them. One is the fact that our population is well over 1.1 million. And that's a big number for us to think about when we're thinking about the amount of residents that we have here in the county. And we're in an area of rapid and continued growth. We've had 23% growth between 2010 and 2021. But the interesting thing is, and we used to say this all the time, that Mecklenburg County was the most populated and populous and also popular county in North Carolina. We no longer are the most populated county in North Carolina. Wake County has actually taken that distinction, but we still are an area in which people want to move to, want to have families and grow. grow old in. And so we are actually doing very, very well when we look at a lot of our metrics as far as demographics. If you're looking at the map on the right, you're seeing the county that's kind of broken up into different areas, or geographic areas. There's a city of Charlotte that's surrounded by the 6 municipalities and towns. About 80% of our population actually lives in Charlotte, in the city of Charlotte. And we have also other populations that are found in our unincorporated areas, which are a little bit more rural, but they still have a bit of an urban flair to them. When we compare ourselves to the state overall, and remember in North Carolina, we have 100 counties. So we're looking at the state averaged out over 100 counties. Our rate, our age, median age for the county is actually a little bit younger than what we would see in the state. 35 years is what we see as far as median age here in the county, and 38 or closer to 39 is what we see in North Carolina. So we have a bit of a younger population here in Mecklenburg County. We are a lot more racial and ethnically diverse than what you would see in the state overall. If you look at the percentage of our white population here, white non-Hispanic, 46% is what we have as far as white non-Hispanic population here in Mecklenburg County. And if we compare that to what we see in North Carolina, it's 63%. So a little bit higher in North Carolina. So we have a lot more racial and ethnic diversity as far as our populations. And then if we look at educational attainment and we just look at one particular metric, and this is populations who are 25 years and older with a bachelor's degree or higher. 46% of the population has a bachelor's degree or higher here in Mecklenburg County, compared to about 32% in the state overall. We also have lower rates of poverty and unemployment, but because we are a large urban area with our urban center, we tend to see a lot of the challenges that you would see in large metropolitan areas, such as unequal economic opportunities. We have issues with affordable housing. That's been some of the comments that we've gotten back from our community members who are participating in the survey, as well as areas in which we do see concentrations of poverty and also high levels of crime. We always look at our birth and death information because that helps us to understand how our population is growing. We had 14,655 births in 2020. That was a little bit higher than what we saw as far as births for 2019. There was some conversation nationally on media, on the news about how the COVID pandemic was going to impact our overall births. Here in our county, the numbers did go up, but the trend overall is in our birth rates is that we're seeing declining births for the county and also for the state. If you're looking to the right on this chart, this is a line chart looking at annual birth rates per 1,000 population for Mecklenburg County and North Carolina. Mecklenburg is in the green line that's going across in that line chart, and North Carolina is in that dark blue, kind of navy blue color. And what you're seeing is the birth rate here is much higher than what you would see in the state, but in both instances, we're seeing a decline in the number of births. Now, as I mentioned before, our population overall is racially and ethnically diverse, and therefore our babies are as well. We have nearly 1/3 of the births that occurred in 2020 were to African-American non-Hispanic mothers, and 1 in 5 births were to Hispanic mothers. Another trend that we're seeing in our birth data is that women are waiting later to have children. We had 1 in 3 births that occurred among women who are 30 to 34 years of age. If we were to look at historical data, maybe about 10 years earlier, that number would probably be closer to the 20 to 29 age for women giving births in that particular population group. So we are seeing some changes there with the amount of births and then overall the composition of our births that we're seeing. When we're looking at leading causes of death, we know that COVID had a huge impact on our population. And one of the ways that it did have was increasing the amount of deaths that we saw, not just on the national level, but on the state level and here locally as well. The chart at the bottom is our annual death rate. This is a death rate for all causes, all causes and all conditions per 100,000 population. And it's for 10 years of information so that you can see the trends that are playing out over time. In general, we've seen increases or steady increases in our death rate over time, both in the nation, both in the state and in Mecklenburg County. But if you look at 2019, there's that jump that we saw when COVID entered the scene, and 2020, our rates went up dramatically for that time period. COVID is now the third leading cause of death here in Mecklenburg County. It's the same on the nation as well. Our first leading cause of death is cancer, followed by heart disease. Fourth is unintentional injury, and then finally stroke. But the thing to remember with our leading causes of death is that different population die of different things differently. So if we looked at information by age, by sex, race, and ethnicity, we would see different leading causes of deaths. Suicide is the second leading cause of death for persons who are between the ages of 15 to 24, letting us know that there is an impact in that group as far as mental health issues. COVID-19 is the leading cause of death for Hispanics in our population. And if you remember with the leading causes of death, COVID is the third leading cause of death, but for our Hispanic population, it is the leading cause of death. Females are more likely to die of Alzheimer's compared to males. And one of the reasons why is because our female population tends to live longer. The life expectancy for females is longer here. So we do see higher rates of Alzheimer's disease death in that female population. And with males, we see a higher rate of deaths due to unintentional injuries, in particular when we're looking at motor vehicle crashes. So these are just some of the highlights of the data. It's not every single thing of the data, but it does give you an idea of what we're seeing as far as births and deaths that are happening here in the county. Now, before we get into the conversation of health issues and the 10 different health issues that are out there, I do want to show you this chart that looks at information from the Robert Wood Johnson Foundation. This is from the county health rankings. We are all pretty familiar probably with social determinants of health. And this is just a conversation about where health begins. Is where we live, where we work, where we learn, and where we play. So social determinants of health and health equity, the larger discussion of health equity, are not considered separate topics for each of these health issues, but they are included in every single one. So we may not have data tonight to show you, but they will be available in the report and also on our online interactive database or dashboard. So here are the 10 health areas of interest, and we're going to spend some time going through each one of them. Again, we're going to be doing some overviews of the topics and then introduce maybe 1 or 2 data points for you to think about. So for each of these health topics, you're going to be getting some slices of data and information. But before we go into those topics, I do want to pause and say this one statement. For many of us, there are health issues that we are extremely passionate about. And those are the ones that we would always prioritize first, regardless of what else is happening. But we want you to take this opportunity to expand your view of health. When you're looking at each of these conditions, I want you to think about the magnitude, the burden of disease that we have in our population. Think about the severity, whether there's long-term implications or complications, disabilities or death, hospitalizations that are associated with them, and whether there's an urgency to address these issues. Oftentimes, for some of these health issues, we may have small numbers, but we know that there's an urgency to address them because there's a potential for a threat to our population health. So we might have an increased urgency to address something. We also want to consider whether there's concern or public will to do things. Some of our residents may find that it may not be to their best of interest to address a particular health topic that we are interested in. So we want to consider our public will and concern, as well as whether there are interventions in place that we can address these health topics with. And if they're not in place, do they exist somewhere else and that we can bring into our population to help? So just think about each of these topic areas and look at the magnitude, severity, urgency to address, public concern, as well as interventions. So let's start with access to care. With access to care, there's a tendency for us to focus just on health insurance. And I want to say that that conversation is a little bit larger than just looking at health insurance coverage. And if you hear noise in the background, unfortunately, I have a neighbor who's doing their lawn care at this particular point because it's that time of evening. But anyhow, health insurance coverage, affordability of care, and access to dental services are just some of the data points that we would look at when we're talking about access to care. But it also looks at whether we're looking at information on whether people have transportation to these particular health services, whether there are enough primary care providers, and whether there are enough of specialized or specialist care. In the county overall, when we're looking at how many people who are uninsured among adults, about 15% of our population has no health insurance. So that equals out to just over 105,000 adults who have no health insurance. But again, health insurance is sort of a fluid thing. You could have health insurance at the beginning of the year, lose health insurance about mid-year, and then pick it up again at the end of the year. So this is more of a fluid kind of thing. And so we know that this is probably an underestimate of the number of people who are uninsured in our population. And that's just looking at adults. We actually have about 7% of children who are uninsured as well. The statement that you're seeing below is a comment from one of our residents who participated in the Community Health Opinion Survey, who pointed out that even with health insurance, there's still problems accessing care. And one of those issues is high healthcare deductible costs and the fact that it can actually crush your budget, this person said, and make things like buying food and fuel very hard to do. So we are seeing a lot of comments from our residents who are talking about affordability issues and just the overall cost of care. When we're talking about where our residents are located, those persons who are uninsured, this is looking at data for the percent of uninsured population by census tract. The dark areas that you're seeing, as well as the ones in the blue, are areas in which we're seeing a higher concentration of those persons who are uninsured. And you can see there's sort of like a crescent shape that's kind of showing in the county. And we see that crescent shape pop up with a lot of different other issues as well. If we looked at this data maybe about 10 years ago, the population was actually more closely concentrated around the city center, and it started to spread out. So it's letting us know that this is a problem that is increasing for a number of our residents in Mecklenburg County. We also wanted to look at whether people had primary care providers, and this is information from our local behavior risk factor surveillance system. 23% of residents said they had no primary care providers. And when we looked at those populations to see who was more likely to report not having a primary care provider, they were more likely to be male, younger, persons of lower income, and those who are uninsured. Now, we are interested in that metrics because we know that, for instance, persons without primary care providers will often use the emergency department as a source of care. So when we look at our emergency department visits, the data, and we look at expected source of pay, we found that people without health insurance were 4 times more likely to use the emergency department versus those persons who have private insurance, which again may indicate that we have a problem here with access to care among our residents. Chronic disease prevention is a pretty big indicator. It covers a lot of different topics. Included in that is leading causes of death, risk factors associated with chronic diseases, and just to begin the conversation looking at leading causes of death here in Mecklenburg County, we've already talked about 5 leading causes of death. This is a list of 10 of the top 10 leading causes of death here in Mecklenburg County. And if you're looking at that list, 7 out of 10 of them are chronic conditions. So when we speak the term of magnitude or burden of disease in the population, this is one that speaks very loudly that there is a burden of disease here dealing with chronic diseases. Those 7 chronic conditions account for 50% of all of deaths that we saw in 2020. So again, that just speaks to the fact that we're dealing with chronic disease or issues surrounding chronic disease within our population. Another layer of complexity and complication to this is that, as we said, COVID is the 3rd leading cause of death here in Mecklenburg County for 2020. And the fact that chronic conditions are associated with higher risk or higher rates of severe illnesses and death as it relates to COVID-19. So it's not just having the chronic conditions, but it's having chronic conditions in the face of other things that might be going on in our life at the time. This particular chart is looking at adults with chronic conditions, and it's combining 3 years of information, 2019 through 2021. And again, it's from our behavior risk factor surveillance system. It's looking at the percent of adults who are 18 and older with each of these chronic conditions. So kidney disease, diabetes, chronic obstructive pulmonary disease, cardiovascular disease, and asthma. And for each of these, you're seeing the percent of people who reported with these particular chronic conditions. If you're looking at those percents, you're probably telling yourself, well, that's interesting, but it doesn't seem like it's a whole lot until you think about the fact that we have a large number of people who live in our county. So if we were to do estimated prevalence based upon these self-reports of chronic conditions, these are the numbers that we would get for chronic diseases in our population. So we move from slightly smaller percents to thousands of people who are living with chronic conditions. And we can't really end this conversation without speaking to the issue of prevention and the fact that there are things that we can do in order to prevent complications, disability, and deaths associated with chronic disease, including healthy eating, physical activity, and not smoking. Emerging health issue is a topic that we've added in this time. This is rounding out our list to 10 instead of 9. But we thought that this was an important issue to include because we're beginning to see a lot more major public health threats to our population. COVID-19 was one. We're dealing with monkeypox now, but even before that, we were dealing with a multi-state outbreak of hepatitis A. And so in 2016, this particular outbreak started, and at this point includes over 30 states. So while we were dealing with the Hep A outbreak, doing response, public health response for that, we were also, COVID-19 actually came into play. And so we had to respond to COVID-19 as well as monkeypox, which is in play now. And we don't know what other threats that may be out there that will threaten the health of our population. One of the things that we're looking at is the increase in antibiotic resistance, and we're seeing that already with some of the multi-drug resistant tuberculosis strains that are out there, as well as gonorrhea strains that are out there that have become resistant to the treatments that we've relied upon. And again, we're also just really concerned about what's happening with our flu because it's easy for that to shift and change and move into our population and cause a lot of complications, hospitalizations, and even deaths. So we don't really know what that next thing will be. We just know that it will be something. So we need to have the infrastructure in place to address these emerging health issues. And that's why this topic is on the list, because we need to evaluate whether we had any cracks in the roads as far as addressing health issues. I think COVID-19 did expose some cracks in the roads for our infrastructure, and the fact that we need to strengthen the things that we do, in particular, our ability to collect data across various systems of care. Healthy environment. This is one of those topics when we're talking about the CHA experience. Many years ago, we would have to include a lot of information to help people understand why this topic is included and why it's so important. But as we deal with issues surrounding climate change, as we're seeing the fires that are breaking out on the West Coast, as we're seeing floodings that's happening here, even locally, the increase in temperatures and how that may affect our heat-related illnesses, and not even that, how it can actually affect our crops and therefore deal with food security within our population. So healthy environment is taking on a more front and center focus for our residents than it has in the past. This sort of data, we're looking at air quality, water quality, and also land use and how well we're using it. And so we're going to show you some of the information that's highlighted in this area. This chart is looking at our air pollution as it relates to particulate matter in Mecklenburg County. Now, this is again from our Robert Wood Johnson Foundation, the county health rankings. The 22 county health rankings are out. The 2022 county health rankings are out. So if you haven't looked at that information, as an epidemiologist, we're always promoting good sources of data, and that is one. This chart is looking at Mecklenburg County, North Carolina, and United States. So across the top in the orange sort of rust color, that is Mecklenburg County. Then you see the green color, that's North Carolina, and the tan kind of yellow color, that is what we're seeing in the nation. The story that you can take home from this chart is that things are getting better as far as air quality. But we have to think about air quality in a regional focus because we don't own just the air that's in Mecklenburg County. It's influenced by what's happening around us. So if you remember several years back, we had some fires that happened in Tennessee, and some of that smoke, or actually a lot of the smoke, actually filtered into our area, and we were able to pick up on that smell of smoke. So it lets us know that something could happen a few states over, a few counties over, and it can influence our air quality here. So it has to be more than just looking at what's happening locally, but looking at the regional development that's going on in our area. Our drinking water meets federal standards, so it's safe to drink, but as our population grows, as we continue to develop, there are concerns about what could happen with our stormwater and whether pollutants can get into our stormwater and get into our lakes and therefore influence our water supply or impact our water supply. So those are concerns. And so the big picture here, as we're dealing with healthy environment, includes climate change, development, and growth that can balance out environmental protection laws, as well as this issue of environmental justice, making sure that when we do make our plans for our cities and our neighborhoods, that we're not segmenting or segregating populations and limiting resources to different groups in our population. Healthy pregnancy is a topic that we usually focus in on prenatal care, adolescence pregnancy, as well as infant mortality rates. But we usually begin this conversation by saying healthy pregnancies begin with healthy mothers. So we look at what's going on as far as preconception health, and the healthier the mothers are before they give birth, before they get pregnant, the healthier or the better their outcomes are. When we looked at our data for 2020, about 50% of births in 2020 were to mothers with an unhealthy preconception body weight, so their BMI was either overweight or obese. When we looked at our births, we saw that about 8% of the mothers who gave birth, or 8% of births in 2020, were to mothers who had gestational diabetes, which again can complicate birth outcomes. And when we're looking at prenatal care, 1 in 5 moms had an adequate level of prenatal care. So again, these are some of the challenges that we're seeing as far as addressing this issue, particularly surrounding maternal mortality and also birth outcomes. But we do have some good news. Overall, our teen birth rates have been declining in the county. This chart is looking at the teen birth rates for 3 populations of teens or young people. We have the 10 to 14-year-old, which is very, very low, and we want to keep that rate very, very low in our county. 15 to 17 years of age is in the aqua or blue color, and then red or burgundy color is 18 and 19 years birth within that particular population. All of the populations are showing that downward trend. So this is good news that we can share as it relates to healthy pregnancies in our county. But then we look at our infant death rates. They have declined from what we've seen in the past. But we're still hovering right about 5 infants who are dying within or before their first birthday for every 1,000 births. So that's something that we've been seeing for a while now. We've had some years where the rates have gone up a little bit, and then some years where they've dropped. But in general, we can average that out, and we can see about 5 infants death before their first birthday for every 1,000 births. The story here continues to be health disparities and what we're seeing as far as long-term health disparities. This chart is looking at the infant death rate by race and ethnicity. The green rate that's going across the top are Black infants who are dying in our county. And then the blue, the navy blue rate is our rate, a line chart here is looking at Hispanic death rates. And then the red or burgundy is what we're seeing as our white population or white infant deaths. In 2020, the Black infant death rate was 3 times higher than what we saw in our white infant death rate. And so we've had some years in where the health disparity or that gap between the populations was much higher, but we've been seeing a consistent level of disparity within this population. And so this is one area of concern that we have when we're talking about making sure everyone or all of our residents are healthy. HIV and STIs. The take-home message that we have here when we're looking at sexually transmitted diseases and also about sex education is that STDs are on the rise, both in the nation, state, and in our county locally. This was even before COVID came into scene. We actually had about 5 to 6 years of increasing STD rates for chlamydia, gonorrhea, and syphilis before we were seeing COVID, and then things just got a little bit more complicated when COVID came into play. So we're seeing an increase in our syphilis rates for those persons. Many of you or some of you might have heard about the fact that we had a syphilis summit last evening or yesterday evening to discuss and talk about the issues surrounding our increasing syphilis numbers. And here is just a quick chart to give you an idea of what we're dealing with. So this is looking at newly diagnosed early syphilis, which includes primary, secondary, and early latent syphilis infections. It's from 2012 going all the way to 2021, and you can definitely see that we're seeing an increase. If we looked at just the past 5 years, we've seen a 40% increase in newly diagnosed syphilis rates within the past 5 years. So those numbers are continuing to go up, and of course, we need to have interventions in place in order to address what's happening in our population. Injury prevention is a big topic as well. It actually includes 2 different broad categories, unintentional injury and intentional injuries. Now we're going to talk about intentional injuries a little bit later with some of our other categories, but for injury prevention for this particular category, we want you to focus on unintentional injury, which includes motor vehicle crashes, drowning, falls, choking, and poisoning, just to name a few. Now, sometimes when people see unintentional injury, they tend to put in the word accidents. We like to focus on the term unintentional injury because accidents give people the idea that there's nothing you can do in order to stop this from happening. It's just an accident. But unintentional injuries are in fact predictable and they are preventable. There are things that we can do in order to reduce the amount of unintentional injuries that we're seeing in our population and also reduce the amount of deaths due to unintentional injury in our population. However, when we looked at the data, unintentional injury is the leading cause of death for persons between the ages of 1 and 44 years of age. So if you remember back to the leading cause of the death for all residents, cancer and heart disease being 1 and 2, COVID being 3, unintentional injury was number 4 for the county, but it's number 1 for this particular population group, followed by homicide and suicide, and then cancer and heart disease. So it lets us know that it is making an impact in our population. When we look at deaths due to unintentional injury, and this is a death rate looking for within our population or within our county, the rate is per 100,000 population. And again, 10 years worth of information. You're going to see a little dotted line here that's running the length of this chart. That's sort of like a linear trend that lets you know whether things are really increasing or whether they're stable or whether things are declining. And you can see that our unintentional injury death rate has increased over time. It's more than doubled in the past decade. And what's driving a lot of this has to do with what's going on with our drug overdose, as well as our opioid-related deaths that are happening in our county. So we're going to talk about that a little bit once we get to substance use disorder. Motor vehicle crashes also are increasing in our county. We've had about a 78% increase in the past decade, starting with 2010 and going into 2020. So we know that this is an issue for our county, and also is something that we can address. There are proven interventions to address these particular conditions. Mental health is a topic that continually ranks high for our residents when we're talking about mental health. This is one of the things that people are responding about or talking about, particularly in having enough care to address and deal with mental health issues. But this data focus on depression, sometimes our suicide rates, and also stigma as it relates to seeking care. So this is just a few points from some of our data sources. Again, this is from the Behavior Risk Factor Surveillance System. And 1 in 6 adults reported that their mental health was not good for 8 or more days in the past month. And so that's people who are dealing with a substantial amount of time in which their mental health is just not good. 1 in 5 adults reported being diagnosed with depression. And again, this is data that includes that time period in which we were dealing with a lot of mental health issues during the COVID pandemic. So it's also showing that we had a lot of mental health issues before and also during the COVID pandemic. When we look at what's going on with our teens, 1 in 5 Charlotte-Mecklenburg teens reported seriously considering suicide in the past 12 months. This is data from the Youth Risk Behavior Survey, and this is data from 2019. So this was even before we were dealing with some of the issues that we were seeing with COVID-19 and some of the mental health and stresses that our populations, our young populations were dealing with. So we are anxiously waiting to get this data updated so that we can provide it for you to see if there are changes in this population as it relates to this particular metric. Our suicide death rates between 2016 and 2020, we can say that on average, we saw about 10 suicide deaths for every 100,000 population. So when we're looking at our suicide death rate, that dotted line showing you that things are fairly stable, but it is still the second leading cause of death for persons 15 to 24. So it might be stable overall, but there are some issues and concerns when we're looking at specific population groups. And this again is data from our behavior risk factor surveillance. Speaking to stigma, 42% of adults believe that people are unsympathetic when it comes to people suffering from mental illnesses. Again, just talking to some of the stigma that people may be facing, and that being a barrier to treatment and care in our population, but also, as I mentioned before, availability of specialists. This is again a comment from one of our residents who took the health opinion survey that says there are just too few counselors and psychiatrists in our county. It takes weeks to get an appointment, and so people are actually using their primary care providers as mental health care specialists, and that can introduce some complications in addressing mental health as well. Substance use disorder. The first thing I want to mention about substance use disorder is that when we consider and we look at this data, we're looking at substance use disorder as a disease. It is a clinical disease is what we're talking about. It is treatable, but that treatment is not always a straight path, and often it includes relapse, but it can be managed successfully with the right interventions and with the right treatment measures. This is looking at alcohol-related crashes and also emergency department visits that are happening in our population. And this data is from the U.S. Department of Transportation that says that 35% of our fatal motor vehicle crashes in Mecklenburg County were alcohol-related. So that's more than a third of the fatal motor vehicle crashes in the county were related back to alcohol. When we looked at emergency department visits, 5,332 emergency department visits had alcohol listed as a contributing cause. And that was for the year of 2021. That's a 14% increase over what we saw in 2020. So it continues to be a problem in our population. Now, opioid-related deaths is one of the issues that you've been hearing about a lot in the media, and it's definitely a concern here locally in Mecklenburg County when we're looking at our data. There are two data points that I want you to look at on this chart. The blue line is representing what we're seeing as death related to drug overdose over time. And then the green line is what we're seeing as far as opioid overdose, deaths related to opioid overdose over time. There was a 167% increase in opioid related deaths between 2010 and 2020. So this is letting you know that this is a real impact in our population. Violence prevention is our final measure, our final health area of interest. And we usually start the conversation of violence, or sometimes when you're looking at data related to violence, it's focused on either victims of violence or those persons who are perpetrators of violent acts. But we also need to talk about exposure to violence. So if you're exposed to violence, there is a level of trauma that the individual can take into themselves that can affect them emotionally, physiologically, and physically. And also when we're talking about children, our young population, those who are exposed to violence early on in childhood may carry these exposures or the adverse effect of these exposure into adulthood, leading to negative outcomes. So we are looking at violence not as just one instance, but rather throughout a person's lifespan when we're talking about this particular indicator. These are deaths, looking at deaths due to homicides in our county. They remain high. We kind of stretch this out so people can see exactly how things have changed over time. Homicide is the second leading cause of death for persons between the ages of 25 and 44. And they also contribute to a substantial amount of deaths that we're seeing in our young male population as well. This final chart, looking at some of the data from violence, is from our Mecklenburg Community Violence Dashboard. If you haven't had an opportunity to go there, I would definitely encourage you to go and look at the information that's collected there. This is a part of that dashboard, looking at the CMPD homicide mapping here that they have. These individual dots represent homicides that have happened in the city of Charlotte. And as you can see, they're spread out in the city. But data from CMPD showed us that about 50% of homicides within a 5-year period occurred within 5 zip codes. So sometimes we're seeing a lot of homicides that are happening in a very concentrated area. The majority of homicides that we see in our county are linked back to firearms. So we cannot really have this discussion or this to actually seek to address what's going on with violence prevention, particularly when we're talking about homicides, until we actually talk about guns and gun-related issues in our county as well. So that was all of the data that I was going to share with you tonight. And I actually stayed on time again. I thought I was going to go a little bit over, but I stayed on time again. So I'm going to stop for just a second and just check in to see, Susan, if you wanted to say anything before we move into the next section.
No, I'm good. Thank you.
Okay. All right, so we're going to end things tonight, or actually we move to the last segment of the meeting, talking about community input. And this is all with the idea that we look for community input in order to influence our priorities and what we need to address as far as major priorities in our county. So we opened up our community health opinion survey officially April 22nd. We had a soft launch before, but the official date for the survey to be open was April 22nd. And we've collected a lot of information as of July 8th. We'll probably get a little bit more information included in this because we're still doing community meetings. This is an example of one that we're doing. But as of July 8th, we had 792 residents who participated in this survey. We like to stress that this is a convenience sample as far as our survey, which means that we sent out this information to people and asked them to participate. They in turn then would send it out to others. And so it may not be representative of everyone in the county, but it does seek to reach as many people as possible. The majority of our survey respondents were from Charlotte, the city of Charlotte. And typically when we do surveys of this nature, we tend to see a lot more females participating than males. We had all racial and ethnic groups presented in the survey, but African Americans had a higher number of participation than other groups. So a part of the survey was to ask people general questions about their community. And there were 6 questions that we were interested in: whether their community offered economic opportunities, whether it was a good place to raise children, whether it was a good place to grow old, whether there was enough healthcare available, and if there were resources in their community if people needed help. And finally, we wanted to know whether their community was a safe place to live. And so we're looking at this information. We did a 5-point Likert scale, looking at whether people agreed, strongly agreed, there was a neutral category, disagreed, or strongly disagreed. We're showing information for those persons who either agreed or strongly agreed. And for each of these statements, you can see the percent of residents who said that they agree or strongly agreed with them. For the community being a good place to raise children, 61% of our residents who participated in the survey said, yes, they believe that their community is a good place to raise children, as well as a good place to grow old. There was a large number of people who felt that there was good healthcare in the area, as well as resources to help people who might be in need of help and assistance. And 55% felt that their community was a safe place to live. The lowest scoring was when we're looking at my community offers economic opportunity. Only 39% of persons who participated in this survey said that they felt that their community offered economic opportunities. So again, that's just one of the challenges that we can see that some of our residents are facing, and some of the data lends itself to that particular statement as well. We also offered or asked a series of open-ended questions dealing with quality of life issues. We asked about access to care and social determinants of health. And finally, we asked the residents to look at these 10 health areas of interest and to prioritize the top 4. So again, not necessarily ranking them, but just prioritize what are your top 4 areas that impact you and your community. We defined community as being your neighborhood or in the immediate surrounding areas of your neighborhood. So that's what we're talking about when we use the term community. It's also what I want you to focus on when you're working through this next exercise, which is to prioritize these health areas as well. So you have a bit of a vantage point because you've had some data that was explained to you and sort of framed each of these health issues, as opposed to people who participated in the survey and just were basically ranking them based upon what they felt. You had data to go along with this. So we're kind of interested, we're very interested to see how you would prioritize each of these issues. We're looking for the top 5 issues, and that's what we're going to take time to do this evening. So what I would like for you to do is to participate in a poll. For some of you, you've probably done Slido polls before, but if you haven't, if you have your phone or some sort of scanning QR scanner, you just need to scan the QR code here and you can participate in the poll. It will ask for your name, and we want to make sure that the people who are participating in the poll are actually those who are participating in this meeting. So it does ask for your name, and then it will ask you to prioritize or rank 5 of the health issues that are listed here. Once you rank them, you'll hit the send button, and then that information will be included in an active poll. If you're not able to join by using the QR code, you can type in either on your phone or on your tablet or your computer, slido.com. It will ask for event ID number, and the number that you're going to put in is 2807397. There's not a space between the 7 and the 3. It does look like there is, but there isn't a space between the 7 and the 3. It's 2807397. So we want to spend about 2 minutes and allow you guys to think about each one of those topic areas. And if you would, participate in the poll by scanning the QR code or going to slido.com.
Hey, Donna, this is Bill Hamill. Can I ask a quick clarifying question? So you had mentioned at the beginning of this that there were 4 that were sort of stood out: access to care, chronic disease management, mental health, and what was the 4th one?
We're going to actually, if you would just hold off on that question for just a second, because we're going to talk a little bit more about those as we move on. I don't want to influence anybody's rankings of these. So we're going to talk about what people actually ranked from the survey. And we're going to then talk about, we had an earlier meeting today at 1:30. So we're going to look at the rankings or the prioritization of that particular meeting as well. So I don't want to influence or bias anyone, but we'll come back to that topic or that question. So please.
Okay, thank you. Thank you.
Mm-hmm. So again, we had 10 different health topics: access to care, chronic disease prevention, emerging health issues, healthy pregnancy, healthy environment, injury prevention, mental health, substance use disorder, and violence prevention as well. So if you would just spend a little time thinking about those issues, and again, we're going to spend about 2 minutes on this. If you don't feel comfortable participating in the poll through the QR scanning or even going to slido.com, you can private message and post your listing of comments or your listing of health issues that you want to rank and include in this ranking, and send it to either myself or Susan Long-Moran, and we'll be able to include this in the after action part of this meeting. So again, we're going to give people a little bit more time to participate. And as you're thinking about this, again, revisit those topics that we talked about with as far as the magnitude of the problem in the community, the severity of the problem, whether there's an urgency to address these issues, whether there's public concern to address them, and whether you think that there are interventions that would work and can be put in place to address each of these topics. And since we have a small group here, we might be able to have some interactive talking. Again, you can post in the chat if you have questions. We have members of our team here who will be answering your questions in the chat room as well. And so just a minute or 2 more. Okay. Looks like things are kind of slowing down. And again, you have an opportunity to continue this. This poll will actually be active for at least another 2 hours. So you can actually participate in it a little bit later. Again, you have to sign in with your name so that we'll know that we're part of the meeting group that we're having tonight to make sure that we including everyone. But right now it looks like access to care is leading the list as far as top 5 health issues that are impacting the people who are attending this meeting and their community. Chronic disease prevention, number 2, and is tied with mental health, violence prevention, and then healthy pregnancy. And that's really interesting how this kind of fell into play here. So again, like I said, we're going to allow people to, you can go back and rank things or prioritize things as we're moving on into the meeting. But it's also interesting that some of the other issues here have fallen fairly low on the list here. Okay. All right, so continue to vote. I think we have a little bit more people who are part of the meeting. So if you want to continue to vote, you can, but I do want to be respectful of our time, being that this is an evening meeting. We appreciate you joining us in the evening to do this exercise and to work through all of this data. So I'm going to move on to show you exactly what we got from this morning's meeting, or this earlier today. We had a meeting of about 70 individuals who joined us, and we asked them to rank these health issues after hearing the data. And this is what they said to speak to the question that was posed earlier. We have access to care as the first health issue, or one of our top health issues, as well as mental health, chronic disease prevention, substance use disorder, and violence prevention. So it's a little bit different from what we're seeing here tonight. But again, everyone's viewpoint is valid and important, and that's why we want to have as many people included in this process as possible, so that we will have an idea of what's going on in our community. Now, when we look at what happened as far as the top health areas of interest for our health opinion survey, mental health, violence prevention, access to care, healthy environment, and then chronic disease preventions were the top 5, or the ones that people listed as being most concerned. The ones that we're dealing with, as we mentioned before, as Susan talked about, are mental health, access to care, violence prevention, and chronic disease prevention. So those 4 areas are coming up, and the list that we have for the community health opinion survey, as well as our community health meetings that we've had tonight, and the one that we have earlier today. So again, I want to thank you for indulging us and listening to so much data at such a late hour, and for participating in the poll. And again, as I said, the poll will remain active for at least another hour after this meeting. So if you want to spend a little bit more time thinking about things and participate in it again, you can, or you can actually edit your responses, but you can't participate in it but once. So all right, so I want to then change the direction of our conversation and allow Susan to lead us into the next steps of this process. Okay. I think Susan might have had to log back on.
Yeah, looks like we just lost her, Donna.
Yeah, I think we did this lose her. I was afraid that was going to happen in the evening. We made it through the entire 1:30 meeting, and we did not lose Susan. There was no problem with the internet, but she did say that there was some storms in the area, so we might have lost her. So we'll just really quickly go through the next steps and what we're going to be doing in the future. As we mentioned before, this is a process that used to occur every 4 years, but it's now occurring every 3 years. So our next step for the Mecklenburg County Public Health is to do our final assessment, which is due to the state in early of March of 2023. As we mentioned before, we are going to be moving towards having an interactive dashboard a data dashboard that will be available for our residents and for the public to use. And it's going to be interactive so that you will be able to look at data as it refers to populations that you're interested in. That's going to happen later on next year. We're going to start that process this year, but we should have it available and pushed out by next year. Additionally, we're going to be going through the process of action planning. As Susan mentioned before, this is part of our community health assessment process to do action planning. And we're using different terminology that we've had used in the past, which is community health improvement plan. That's going to be due to the state in early September of 2023. But this is where we look at these prioritized areas and begin to do community level work. So we will be reaching out to you. We'll be checking back in with you to see if you're interested in working alongside of us as we seek to address many of the health issues that are going on in our county, particularly the ones that have been prioritized for our population. And then we also want to emphasize that we are going to begin planning for the 2025 community health assessment. That's going to start next year. So we want to get a jump on things. COVID has really messed up this process for us. We're so used to doing a lot of face-to-face interactions with people. We had a big priority setting meeting that we would invite people to, and there would be a lot of networking and communications, and people could talk back and forth with each other. And so we are doing things virtually just for as a mean of protecting our population. But we plan to actually incorporate a lot more of that in-face, person kind of conversations, in-person conversations starting in 2023. We're going to begin planning for that. And we want to be able to do that for our 2025 community health assessment. So the main message here is to stay tuned for more information, and we will be in contact with all of you, sending out emails just to make sure that you're aware of the next steps in our process. So again, we want to take this time to thank every last one of you for attending. It takes a lot of commitment to sit at 7 o'clock at night and listen to data. I am in awe of every last one of you that attended this meeting and actually stuck with us through the whole process. I would be remiss if I didn't stop for just a second and just say, are there any sort of closing comments, either from Dr. Scott or Dr. Washington, who are here in our meeting room?
None for me, Donna. Just thank you all for being with us tonight. And certainly if folks have any other questions, we'll stick around for a bit and happy to answer them.
Absolutely.
And here, thank you all for attending.
Yep.
Hey, Donna, this is great. Will you be sending the slides out? I think you said you would, correct?
Absolutely. So we're going to post these slides as well as one of the recordings, either the 1:30 recording or the 7 p.m. recording on our website. Don't look for it tomorrow. It won't be up there tomorrow. Give us a week or so to make sure that we have the recording together and post it. But we will have these slides available. And then when they are available, if you gave us your correct email with the registration, we'll send that out to let people know when you can go ahead and get these slides. Yes, absolutely. Thank you for asking that question.
Great, thank you.
And I think Susan is back with us. Susan, do you want to have any sort of closing comments or remarks?
I will just echo what you said. I'm so impressed with people who are willing to come home after a long day and then sit down and listen to a lot of health information. I salute you. And I apologize, my computer just kicked me out right when I was supposed to start talking. I'm not sure what that was all about. But again, thank you very much. If you have additional questions, post them in the chat, ask them now. We will be around for a little while if you'd like to ask them, or feel free in the days and weeks upcoming to contact us. Maybe I'll put my email in the chat. How's that?
Oh, that'll be a good idea.
Okay. And I can put Donna's in there too. But thank you, everybody. Thank you so much.
And if you want to stick around for questions, or you've got a lot of data people here who can answer those questions for you. So feel free to answer those questions or ask any questions you may have. Okay, both of our emails are there for you, so feel free to reach out. And I hope everyone have a great evening. Thank you again for attending.
Thank you all. Appreciate it.
Thank you, everybody.
All right, I think it's just the 5 of us now. Yep,
Yes.
Yeah.
so I'm going to stop the recording.